Hello, I'm Lisa Saldana and I'm here to teach you all about tiredness all the time. So this is a very common symptom and I want to help you understand how to take a comprehensive history and do a thorough assessment. This lecture will cover the key differentials when taking a history from a patient presenting with tiredness all the time. We'll talk through how to approach examining these patients and what key investigations you might want to do for assessing patients who come in with chronic tiredness. Why am I covering this topic? It's really common, it's challenging, and you can feel confident exploring this area. Having worked in general practice, tiredness all the time was one of the most common presenting complaints that I saw, and having a structured approach was important to ensure that you cover all the key areas. So differentials of tiredness, I want you to make a list of 6 possible differentials, think of common causes and think about sinister causes. Are your differentials broad? So pause the video for a minute or two and just make that list. Potential areas to consider: sleep, mental health, endocrine causes, anemia, stress, diet, systemic disease and infected causes. Now these are just some of the key areas to inquire about, but hopefully this gives you a broad sense of the types of areas you might want to go into. Where to start when taking a history of tiredness? Ask open questions to gain more details about the symptoms. So for example, could you tell me more about the tiredness that you've been experiencing? Allow the patient to tell their story and then listen and listen. What next? Ask another open question based on a cue that the patient has given. Allow the patient to elaborate as much as possible and signpost when you're changing topics to help focus the consultation. By asking open questions, you can establish all of the following. So when did the tiredness begin? Is it an acute or a chronic problem? Is it all day, every day, or situational? Does anything improve or worsen the tiredness? Next, I would want to review the sleep. What about sleep hygiene? So are they doing something that might potentially hinder the way they get to sleep? So it could be looking at phones late at night, looking at screens, doing work late into the evenings, eating late at night, etc. Also think about the environment in their room as well. So is it dark enough? Is it comfortable? Are there any particular life stresses that are affecting sleep? So it could be anxiety driven. Perhaps there is a partner who's snoring at night and that could contribute to sleep issues. Then review for symptoms of depression and anxiety. So think about mood changes. Have they got any loss of interest in hobbies? So that's anhedonia. Are there any appetite changes? Any weight changes? So that could be up or down. And do they feel more irritable than normal? Next, I would move on to reviewing the gastrointestinal system, so the GI system. Ask an open question to explore bowel habit. So could you tell me about how your bowels have been recently? Have there been any changes? Is there any blood in the stool? Or any associated symptoms such as abdominal pain, vomiting, weight loss, change in appetite? So notice how weight loss and appetite keeps coming up. It doesn't matter where you ask about it, but make sure it is addressed somewhere within your history. And lastly, I would consider bloating in the GI system. Review the diet and the vitamin profiles. So what I mean by this is to consider whether the diet is low in iron, low in vitamin B12, low in vitamin D or calcium, because all of these things could make a patient feel tired. So think about whether the diet is vegetarian or vegan, pescatarian. Are they using supplements, for example? So we're thinking, is there a potential anemia or a vitamin deficiency? And then vitamin D in particular, also consider whether there is enough sun exposure and the skin type. Review the endocrine system. So it's useful to understand the patterns of symptoms that come with different endocrine diseases. Think about weight and appetite changes, any polydipsia and polyuria, skin and hair changes, menstrual cycle changes, and temperature control. These are some of the most common things that change in the endocrine system with some of the commonest disorders. These are the typical patterns of symptoms that might come with diabetes, so perhaps frequent urination, blurred vision, dizziness, hunger, tingling in the hands and feet, polydipsia, fatigue, weight loss, and headaches. Similarly, we can consider patterns of symptoms for common thyroid conditions. So hypothyroidism classically presents with weight gain, cold intolerance, lower mood, hair loss, bradycardia, constipation, menstrual changes, fatigue, and joint pain. So it's just about knowing that if you see some of these symptoms, we've got to explore the rest of them to try and rule out some of these conditions. The same goes for hypothyroidism. What are the common patterns of hypothyroidism? So the patient may have a goiter, they might feel tired, they might have lost weight, have protruding eyes. If it's a case of Graves' disease, for example, they may have tremors in the hands, hair loss, memory problems, fertility issues, and mood problems. So I would review these systems. I would think about the cardiovascular system, and I'd want to know about any chest pain, shortness of breath, dizziness, and edema. And then the respiratory system, so cough, hemoptysis, shortness of breath, recurrent chest infections, maybe COVID or recent viral illnesses. I'd move on to review the gynecological system. So pregnancy is a common cause of tiredness. Have they had menorrhagia? So are they bleeding very heavily and then they've developed anemia? Do they have postcoital bleeding? Again, they could have developed anemia as a result of this. Is there intermenstrual bleeding? This is a red flag in gynecological disease, and the same with postmenopausal bleeding. Essentially, what we should be doing with any patient that comes in with tiredness all the time is to explore symptoms of anemia. So I'd start with asking about dizziness, palpitations, shortness of breath, and we're trying to establish what the cause of the anemia is. So if they've got any of these symptoms, we then need to find out, are they bleeding from somewhere? Have they got a problem with making their red blood cells? Where does the problem lie? Features of systemic illness. Always ask about these things because it will give you a good sense of whether you've thought about a broad sense of differentials. So fevers, night sweats, and weight loss comes up again. Any lymph node enlargement and any recent illness. Review other key systems. So these might just be things like the musculoskeletal system. So think about joint pain, stiffness and swelling. Again, these chronic MSK conditions can present with tiredness all the time. Think about neurological symptoms, so weakness, loss of motor or sensory function, and any visual changes. And dermatology, so any skin changes, rashes, or itching. Remember that chronic conditions are often associated with fatigue, so things like rheumatoid arthritis, COPD, and a whole remit of medical conditions. Then you move on to taking a relevant past medical history. So have they previously been diagnosed with any conditions and what's the management of those? Have there been any previous episodes of anemia? Have there been any GI investigations so far, so perhaps a colonoscopy? And has there been any previous surgery? So have they recently lost large amounts of blood? What pathologies do you think might cause chronic fatigue? Pause the video and write down a few examples. So chronic renal failure, post-viral chronic fatigue syndrome, type 1 and type 2 diabetes, autoimmune diseases, cancer, and immune deficiency. So these are just some examples. There are many more, but this should give you a sense about how broad the inquiry needs to be when a patient presents with tiredness all the time. Drug history. So are there any prescribed, over-the-counter or herbal medications? Any allergies, and other relevant history? Are they on an anticoagulant medication such as warfarin or a DOAC? Remember that these increase the likelihood of bleeding and hence anemia. Iron supplements. So do they already have known iron deficiency anemia? Remember that many medications can cause fatigue, such as long-acting antihistamines, so it's worth finding out if the patient has recently started anything new or is taking anything over the counter. Family history. Are there any conditions known to run in the family? And specifically, are there any cancers or autoimmune disorders? Social history. So ask about smoking, alcohol, caffeine intake, recreational drug use, diet and exercise, and travel history. Moving on to other elements of the social history, think about the home environment. So who do they live with? What's their support network like? Are they caring for anyone? And are there any problems at home? So financial worries, perhaps marital problems and stress. Think about work life. So are there any acute stressors? Is there shift work that could contribute to the tiredness all the time? So essentially, how is the tiredness impacting on the patient's life? Remember to always inquire about the patient's ideas, concerns, and expectations. So what's beneath the surface for this patient? What is their patient agenda here? Essentially, what does the patient think might be causing the tiredness? Is there something that particularly worries them? What made them come today? If it's been ongoing for some time, it's really useful to find out if it's because the symptoms have been getting progressively worse. Gauge what they are wanting from the consultation. So is it a referral, a sick note, a scan, blood test, etc. Remember that the patient perspective should be discussed where it naturally falls in the consultation, not necessarily all at once. The examination will, of course, depend on the history. Take a general assessment. So does the patient appear well or unwell? How are the baseline observations? I would always assess the cardiovascular and respiratory systems for patients coming in with tiredness. So check the pulse rate, the rhythm, check for conjunctival pallor, listen for heart sounds and murmurs, auscultate the lungs and listen for crackles. And then I would also examine the GI system, so I'd palpate for tenderness and any abdominal masses. I would then consider whether a rectal examination would be necessary to check for PR bleeding and any rectal masses, if that was in keeping with the history, of course. So continuing with examinations, I would want to assess the endocrine system, so look for peripheral signs of thyroid disease and palpate the thyroid, and also the gynecological system. So think about doing a pelvic and speculum examination if there are suggestions of gynecological disease in the history. Think about hematology conditions as well. Are there signs of pallor or bruising? Are there any swollen lymph nodes? Always assess mental health, so assess for clinical signs of depression. You might need to examine other systems as well if they are clinically indicated from the history. So you might need to look at the MSK system, dermatology, neurological, and potentially other systems as well. Investigations. Make a list of the tests you would like to do and what you would be looking for. Remember that investigations depend on the clinical features and the examination. So blood tests, the first line, I would want to do a full blood count, look at the serum ferritin, the ESR, TFTs, LFTs, Usenes, HbA1c. You might think about doing an IgA if you're thinking about celiac disease, and then a bone profile and myeloma screen if indicated. You might think about also assessing the urine for blood, protein and glucose. Blood tests, these are second line if indicated, so you might consider doing B12 and folate, vitamin D, and other tests if relevant to the clinical history, so for example HIV testing. So think broadly, common and sinister causes whenever you see a patient presenting with tiredness all the time. You need to cover the red flags for appropriate systems in the history, and as I suggested, there are a number of systems to ask about. Complete a comprehensive examination and investigate according to what you found. If you like this mini lecture, you might also like these lectures and courses. The Essential OSCE Guide, Advice from an OSCE Expert, The Ultimate Guide to Breaking Bad News, How to Explore Weight Loss, this is coming soon, and the same with Taking a Comprehensive Medical History, this is also coming soon. You can find them all, as well as a number of other resources at lisasaldana.com. Thanks for tuning in, see you next time.